Hello, everyone. Good afternoon. So sorry, there's some technical glitch. So due to which we are joining, I think 4 or 5 minutes late. So not an issue now. So Dr. Ashish has joined with us. So before I start, I would just like to give a warm welcome to Mr. Ashish Kunwar. So, sir, thank you so much for taking out your time and joining us. To so that to take us through this wonderful session. So, Mr. Dr. Ashish Kunwar, he is a gastroscience and liver transplant surgeon, and he is like expertise in diagnostics and therapeutic endoscopic with special interest in endohepatology. So I would be, handing over this room to Mr. Ashish to take this further. So Dr. Ashish will help us to understand what this entire session is all about, what are the importance and what are the, precautions and things we can follow to overcome this kind of disease. So Dr. Ashish, I would requesting you to please take this further from here.
Yeah, thank you. Thank you for introduction. So I'm Dr. Ashish. I'm a consultant in hepatology. So in the next few slides, I will be telling about the fatty liver disease. That's a silent epidemic in our workplace, and to understand more about it and how to detect it early and treat it. So in the next few slides, I will be discussing regarding fatty liver, what its causes, clinical features, what clinical implications it has, definitely about the treatment and conclusion, after which we can take some questions. So I know there is no poll here, but if you can think about it. So how many in this room thinks that they have fatty liver? Just remember whether you have or not. In the end of session, we will ask how much of you think it was positive. Even if you don't, let's see what it is. So in the crux, what is fatty liver? So to make it very basic, this is the normal liver, shine pristine brown. When the excess fat that is made in the body, so liver act as factory that removes the fat, but that factory gets malfunction or gets overburdened, so that liver gets deposited around the liver. In span of time, prolonged fatty infiltration, that fat goes inside the liver cells, hepatocytes, and that is known as uh, hello, hello, am I audible?
Yes, sir, you're audible. Please continue.
So I'm not sure my slide is there. Okay. Uh,
The screen is not visible, sir, but you can continue.
so yeah, so that fat get infiltrated, it is known as fatty liver. So what problem that fatty liver cause? It cause many problems ranging from the cardiovascular, from metabolic health, for obesity. So there are two type of fatty liver disease. One is known as MASLD, that is metabolic associated fatty liver disease. Another known as alcohol associated fatty liver disease. So these terms are intermingled because if we drink excess alcohol, that alcohol also leads to the fatty liver disease. Similarly, if we eat junk food, do not exercise, it can also lead to MASLD phenomena. Why we are talking about this? Because in the recent survey, it has shown that 30 to 38% of urban Indians are suffering from fatty liver. Of this 38%, 78% has diabetic. And this modern epidemic is increasing in age group of less than 40 years of age. So young population are more prone to that. And also it is now the leading cause of chronic liver disease that happens when the liver gets severely damaged. Regionally wise, this epidemic is more predominant in the urban area as compared to the rural population. Now, if we want to discuss what causes the fatty liver disease or what is its mechanism, so one of the major causes is hyperlipidemia. What I mean by hyperlipidemia? So, when the body's ability to surpass the removal of fat, so the liver capacity to metabolize get hampered. So that leads to the hyperlipidemia. The situation in which it occurs, one is BMI. If your BMI is more than 25, you fall in the obese category. Or if your waist circumference is more than 19 centimeter in male and 80 centimeter in female, then you come in the BMI that is higher than normal limit. People who have diabetes, or in certain group of patients who have inherent hyperlipidemia. So now, if in front of the liver there is large amount of fat, what this fat do? It creeps into the liver, it causes inflammation. Ultimately, it leads to the damaging of the liver cells. In certain conditions, such as suppose somebody taking good quantity of ethanol, somebody suffering from hepatitis B or hepatitis C, or somebody is chronic ill with other ailment, the mechanism of fatty liver get increased. So it acts as confound phenomena in which it acts as a bystander to the other disease. What are the signs and symptoms? So we can divide mast cell into three groups. One is early stage, that is usually silent. Then second is inflammatory stage, also known as MASH. And third is advanced stage or cirrhosis. So just discuss the all the three phases. So in early stage, also known as silent phase, the main symptom is mild fatigue. There is right upper quadrant pain, very dull aching pain happening in the right side of the body just below the rib area. If we do blood test, we will find it to be absolutely normal. So there is no way to guess there whether you have fatty liver or not. So usually incidentally it gets picked up during the ultrasonography. So you suppose you are suffering from mild fatigue, you are getting tiredness, not feeling good, you have done blood test, it is absolutely normal. So you just also do ultrasonography to find whether any pain, what is the cause of pain, in which it is incidentally detected as fatty liver. So suppose this fatty liver get persist for over the period of 2 3 years, 5 years, so it causes inflammation. What are the symptoms? Persistent fatigue. We have done LFT, liver function test, and some enzymes are increased. The most important enzymes are SGOT and SGPT. The pain usually persists, and if somebody is suffering from diabetes, they found that their diabetes get worse. Their HbA1c level, that is the marker of diabetes, gets prolonged up in the range of 7, 8, 9. So again, if this scenario persists for longer duration, it ultimately leads to liver cirrhosis. So what is liver cirrhosis? It is that stage of fatty liver that is irreversible and is accompanied by symptoms such as abdominal swelling, yellow discoloration of eyes or jaundice. There is some swelling in the lower part of the leg. In advanced stage, people also suffer from blood vomiting, comatose situation, and persistent confusion. So these three, early stage, intermediate stage, and advanced stage, are per se for the MASLD. But this MASLD or fatty liver is not the disease of liver alone, because it also hampers other body parts such as in heart. It can lead to the early changes of coronary artery disease or heart attack. It worsens the insulin sensitivity, leading to the insulin resistance, diabetes. Second, it also impaired the bone health, leading to the early osteoporosis that can cause fractures. Third, in the long duration, sometimes it can also affect kidney. So what I'm trying to explain that it is not a just disease of liver, it is a multi-system disease affecting the kidney, heart, bone, insulin level, and obviously the liver. Just one point I want to make highlight of association with cardiovascular risk. So in this group of patient who has fatty liver, there's higher chance of death due to heart attack. In fact, the most people die with heart attack than with
Sir,
liver disease.
so sorry to interrupt. Just wanted
Yeah.
to check if you can. Your screen is not visible, sir. Yeah.
Okay. Just hold on.
Is my screen visible,
Yeah, your
Shahid?
screen is visible. Yeah, yeah.
Sir, I'll help you with the screen. Just let me
Yeah, sure,
know
sure.
on which slide you are.
Just I
And
will
whenever you
go through
want
the
me
slides
to
once
change the
again.
slide, just let me know that
Yeah, yeah.
slide needs
Can
to
you go
So,
change.
next
sir,
slide?
I
I
would
will just
request you can switch on your camera as well so that people can view you as well.
sorry.
No, I'm saying that it would be great if you can switch on your camera also so
Okay,
that
1
we
minute,
can
1
be
minute.
able to view you.
Yeah.
Yeah, great. Sir. That's good.
Yeah. So just I will just go through the what the I have explained. Can you next slide, please? A slide. Yeah, next slide. Next slide. So yeah, this was I was talking about the prevalence. As you see that the area in red are like 30% of population are suffering from fatty liver. So if you see the India, North America, the part of Egypt, Sudan, and Latin America has around 44%. Next slide. So again, this diagram tell us that what is the overall rise in the prevalence. Like in the early 90s, the area involved for Nigeria area around 2010 2019, the increase has been seen in Afghanistan, Chad, Guyana, and overall if you see that most of the countries have prevalence more than 30%. That shows that this disease is something that is growing as a modern epidemic, and I guess in the next 10 20 years around 50% of us will be suffering from this. Next slide, please. This, as I have already discussed, like around 30 to 38% of urban population is affected by this disease, with the more increase in the younger population, and is one of the leading cause of chronic liver disease. Next slide. Again, this is just data showing the discrepancy according to these states. Like in northern India, the prevalence was around 30%. In southern part was around 40%. In East India, it was around 14%, and in the Maharashtra region, it was around 25%. But overall, if we find that as compared to the urban, the rural population has less prevalence, and in urban, it was ranging around 40%. Next. So this was just about the mechanism, like what triggers the fatty liver. It is hyperlipidemia, that is excess fat, along with diabetes and some inherited disease. And again, apart from that, some chronic illness, consumption of ethanol, certain drugs can also lead to the worsening of the liver cell in this group of patients. Next slide. So this is just a diagram that shows the what group of people are more prone to develop fatty liver disease. So somebody who is taking junk food regularly, has sedentary lifestyle, consumption of nicotine, certain environmental or toxin exposure. Apart from that, person who are like suffering from psychiatric illness, genetics also play some part. Like somebody has parents with diabetes, hypertension, so they are more prone to develop fatty liver, and obviously diabetes and obesity are the major risk factor. Next slides. So this was the sign and symptoms. So we usually divide it in the early stage, middle stage or inflammatory stage, and advanced stage. In the next few slides we will discuss about the stages. Next slide. So in the early stage, the usually symptoms fatigue, absolutely normal liver function test, incidentally found in the ultrasonography. So if suppose during your health checkup you have done LFT, you say it is normal, I am okay. No. If you think you are going into the obese category, if you think your weight is more than the normal or your BMI is more than 25, you should get ultrasonography done, because that is the preliminary tool that can tell whether you have fatty liver or not. Next slides. Again, this middle stage, this is the stage in which we intervene, we can cure it. Like we can go back to the normal liver. In this stage, usually what we found, LFT showing some abnormality. There's the persistent of right upper quadrant pain. If somebody is diabetes, his or her diabetic get worsen, and obviously the one of the symptom is persistent weakness, fatigue, not keen of doing much work. So this stage is important because if we diagnose at this level, we can definitely cure it. But if we miss this stage and the liver progress to the next stage, that is cirrhosis, that next slide, yeah. So cirrhosis, in which there occur signs of liver failure, such as water in the tummy, known as ascites, persistent jaundice, swelling in the lower limb, encephalopathy, confusion, bleeding from the mouth. So it is the stage of irreversible, like we cannot do anything. Maybe we need to change the liver or liver transplant. So middle stage is the most important. This is just a few diagrams showing the how the patient presented in the advanced liver cirrhosis, like jaundice, tummy showing fluid or ascites, bleeding from the mouth. Some people gradually develop liver cancer, and obviously confusion or hepatic encephalopathy. Next slide. This is just me telling that NAFLD is not a liver alone disease. It is a disease involving the multi-system, incorporating heart, kidneys, pancreas or insulin sensitivity, obesity, diabetes, and also some people who are obese, they have obstructive sleep apnea. Like they will be yawning in the morning and in the night it is difficult to get sleep, or they wake up inappropriately during the sleep. This happen because of the short neck or obstructive sleep apnea symptoms. Next slide. Again, the one thing to notice that the major culprit in NAFLD that leads to the death is heart. So most of the NAFLD stage A, stage 2 patients die from heart disease rather than the liver disease. Why this happened? Because they shared the same metabolic risk factors such as high lipid profile, diabetes, overweight, low HDL, and sedentary lifestyle. So in this group of patients, we have to address aggressively to modify the risk that is pertaining and causing this damage to the liver as well as heart. Next slide. So how to diagnose? So diagnosis, as we have discussed, made on the availability of blood test, some imaging study, and obviously the gold standard is liver biopsy test. That does tell us the amount of liver that is suffering from just fat infiltration or inflammation. Next slide. So in the group of blood test, what we see liver function test that usually include main is OTPT, that is the marker of inflammation. Apart from that, bilirubin level, lipid profile, complete blood count, RFT. The main important thing to do is the check the sugar levels and HbA1c that tell us how the sugar profile is behaving in the last 3 months. Yeah, next slide. So many of you must have done ultrasonography and they usually label as grade 1, grade 2, grade 3 fatty liver. What does this mean? So ultrasonography picks fat as a black. If you see the images, you will see it as a black shadowing. So grade 1 is told when the fat percentage is ranging from 5 to 33, grade 2 when it is ranging from 34 to 66, and grade 3 when it is more than 66. So it only tells about the fat in front of the liver. We cannot see what is happening behind this fat, how much inflammation is going. For this, we have to do other tests. Next slide. Then what is the next test? The next test is fibroscan. what the fibers can do. So this is the probe which has some piezoelectric material in front. It sends shock wave in the liver. So the liver tissue is usually very elastic, normal liver tissue. But if there is fat deposition or there occurring persistent inflammation, this liver tissue get hardened, it gets stiffened, it get fibrous. So it will not transmit the shock wave as good as it would have been. So we can tell on this modality how much liver is fibrosis. I have just attached a sample report in which if you see that the blue color reading is 369, that is telling us the amount of fat, and the red color reading is showing the amount of stiffness. It is 7.4. Below 7 is normal, above 7 is abnormal. So if you have diagnosed with ultrasonography showing fatty liver and you want to know how to proceed further, so definitely we need to do FibroScan. Next slide. Again, the previous two tests that we have discussed, ultrasonography and FibroScan, are just machine-based tests. So we cannot see what is happening at the micrological level. So for this, gold standard is liver biopsy. We do not do biopsy in every patient, but only in patient in which we have some diagnostic dilemma or we are confused that what we are dealing with. So because we can see the liver tissue under the microscopy. So if just you see this 3 diagram, first is NASH showing large whitish particles, that is fat. Gradually the fat particles increase leading to NAFLD, and normal liver, that is absolutely pristine with no zero fat particle. Next slide. So how to manage it? So in this diagram, if you see, the first is pharmacotherapy, next is surgical option, third is lifestyle modification. But I believe the first is lifestyle modification, followed by pharmacotherapy and surgical option. Ultimately, the treatment involves modification of the risk factor and removal of the excess body fat, controlling of the lipid profile, and definitely the sugar level. So it is not just a single modality that will help the cure fat liver. It is more of a multimodal treatment. This is just a algorithm from the recent guidelines, the liver guideline that is published by NASR, that is our National Society for Liver Disease. So it says that first we have to manage comorbidities such as diabetes, hypertension, obesity, anybody has cardiac disease, hypothyroidism, PCOS, sleep apnea. Then definitely we have to modify our life based on what diet we are taking, how much exercise we are doing, and definitely weight reduction. So if it is early disease, we usually monitor. If it is showing some amount of fibrosis, then we give pharmacotherapy. And if it is cirrhosis, that is stage of irreversibility, then there is no role of any pharmacotherapy. Then we treat cirrhosis per se for side effect of and complication of cirrhosis. Next slide. So as we have been talking about how to prevent it, so best way of prevention is to modify your life by doing what? Exercise. So suppose you lose 5 to 10% of your body weight. It is said that by losing 5% of body fat, the liver steatosis of fat decreases subsequently. If it is fibrosis, then we need to target the 10% weight reduction. Do regular exercise, consume a balanced diet that includes limited intake of salt, sugar, and oil, and increase intake of protein, fiber-rich diet, whole grain, vegetable. Control any comorbidity you have with the help of exercise or medication, and definitely avoid excess alcohol consumption. Next slide. So just a slide on what to do and what not to do. So in the do list, definitely maintain a healthy weight and through balanced diet and exercise. Incorporate food, vegetable, whole grains, fiber in your diet. Limit ethanol intake or completely abstinence if you can. Monitor your cholesterol and triglycerides level and try to keep it in the healthy ranges. At least aim for doing 30 minutes exercise In case of any doubts, seek guidance from a healthcare professional, and also try to manage your comorbidities. What not to do: avoid consumption of high fat processed or fried food, avoid consumption of sugary beverage, alcohol. Do not neglect any regular checkup that have shown fatty liver or deranged LFT. Avoid sedentary lifestyle. Limit the extreme diets like and supplements. Some Ayurvedic supplements also causes infiltration of fat. Do not ignore poorly managed health issues, and obviously do not skip meals or irregular eating pattern. Next slide. So my final message for today will be: fatty liver is silent but a progressive disease. It is not a disease that happens in span of 1 month, 2 months, but it usually happens in year. What it happens, it reflects our daily lifestyle choices, what how we are doing and doing in our life. Most advanced cases are preventable with a healthy lifestyle and use of pharmacotherapy. So small steps, if you start today, it will help in protecting your liver in a long way and definitely curing this modern epidemic. Thank you. I think this is the last slide. Thank you.
Thank you so much, Dr. Ashish. So I will be putting the questions in the chat box.
Yeah.
Mansi
Yeah.
will read out the questions for you. You can just answer the questions one by one.
Thank you so much, Dr. Singh. The session was truly insightful. And with that, we will start with the question and answer. So we have our first question. I will read that out for you. So if you're now ready, Dr. Ashish, we can start.
Yeah, sure.
Perfect. So, Dr. Ashish, the first question is, how and why does a fatty formation happen?
Okay. So, whatever food you eat, it is consists of carbohydrate, protein, and fat. So, when this fat goes inside the intestine, the body digests it and breaks it into the small particle. So, that particle is known as fatty acids. That fatty acids get inside the blood goes in the liver. The liver, as I earlier told, is a factory that removes the bad fatty acids and take good fatty acid. From this fatty acid, usually the cholesterol is made. But when that factory gets increased in the limit that it cannot do, it's like its production is get hampered because of the excess overload, then the fat get deposits. If that fat get deposits, it ultimately leads to the inflammation when it goes inside the liver. So to answer your question, how the fat diet form, it gets formed from the diet we eat and how much less we are burning the fat after eating it.
Thank you for answering that question, Dr. Singh. Nikhil asks that he is unable to drop his weight, though he doesn't have any sort of alcohol on daily basis. Can fatty liver be the problem?
So fatty liver is usually occur because of you're not able to lose weight. So it is not that you have fatty liver that is causing the weight gain. It is opposite. Your weight gain causes the fatty liver. Why you are not able to lose weight? I think the best answer is to what's your BMI. Get your BMI done. If it is more than 25, then definitely you need to get workup on risk of metabolic disease by doing some basic work and ultrasonography. If in that we found any abnormality, then we can target the abnormality based on the abnormal finding we got. If suppose it is absolutely normal, then you need to look at what you are eating and how much exercise you're doing.
Thank you for answering that question for us, Dr. Singh. So Hemant is asking that I get fatty liver every time I go with the full body checkup. It has not worsened yet, even after my regular routine. Is there any precaution I should be taking?
So fatty liver disease is just like your long-term provident fund. So it will not change anything in span of 1 month or 1 year. So suppose somebody develops fatty liver at the age of 30, its side effect will show in age of 38 and 40. Again, it is not only the fatty liver that is harmful, it is apart from fatty liver, the sister organs that get affected. So I agree with you that every time you do blood checkup, it is showing just fatty liver. So try to target what is causing it fatty liver, whether you require any pharmacotherapy or not. If your liver enzymes are normal, I don't think so you require any pharmacotherapy. You need to just work on your lifestyle modification. It is good that you are getting this full body checkup every yearly, because that will keep your physician vigilant. Okay, you are at the high risk group or low risk group. So yeah, precaution wise, definitely cut off all the refined food you can taking. Try to, if suppose you have eaten something extra in that day, try to burn calorie by going to the gym or basic exercise.
So, Dr. Singh, thank you for answering that question for us. The next question is requested by Mr. R.L. Mishra. He says he has fatty liver, his age is 55, gender male, and he's also on high BP medication. So, could you guide him on how he can deal with this?
Okay, so considering his age 55, so it is not that it must have developed in the last 1 2 years. It may have been going for 5 6 7 years, and he has also comorbidities of hypertension. So first thing should be that his BP should be controlled with medication, without medication, whatever, by exercise, but BP should be under control. If we control the BP, then we have to target our intake of calories. See, we have to be calorie deficient to cure the fatty liver. So many patient, I say, they said that we are doing regular exercise, but they also say that we are eating lots of food and refined thing. So at least you have to make a balance between both of things. So for you, maintain a healthy lifestyle and control your BP medication. Take medication regularly.
Thank you for answering that question for us, Dr. Singh. Next question. What are the symptoms of fatty liver? Can we reverse this through diet or lifestyle changes?
So
This
as
question has been asked by many members. So yeah,
Okay.
just wanted to let you know that.
Yeah. So as discussed in the slides, the symptom of fatty liver gets divided into three phases, whether it is early phase, whether it is intermediate phase, or it is advanced stage. So early phase, usually no symptom is there, apart from sometimes you will feel dull aching pain or something like small pain in the right side of the body, just below the rib area. You do LFT, that may or may not be normal, and ultrasonography showing fatty liver. So clinically, you may feel absolutely normal, like you are doing good. You just one day went to a doctor with a friend and do routine blood test and found to fatty liver. So very difficult to say that what are the absolute symptom of fatty liver in early stage. Definitely in advanced stage or intermediate stage, you have more symptoms that persistent of fatigue. Some the pain in the right upper quadrant get worsen over the period of time, and in advanced stage you have jaundice and blotting and blood vomiting of this feature. Second part of the question was, can we reverse it? Definitely we can reverse till it has gone to the advanced stage. So in early or intermediate stage we can reverse it. In intermediate stage, definitely requires some help from the medication and pharmacotherapy, but in early stage absolutely no need for medication. It is the only and only diet that helps, apart from regular exercise.
Thank you for answering that question for us, Dr. Singh. I'm moving to the next question. So Mr. Kumar says he has grade 2 fatty liver and also having digestion related issues. Could you suggest what should be the next steps?
So there we are dealing with two problem. One is fatty liver that we have discussed at length. What to do about this? Second is digestive related issue. So as I have mentioned that fatty liver is not a just disease of the liver; it is a multi-system disease. So sometimes what happen, what we are eating or how your digestion is going on, it can affect your gut microbiota. That can lead to the faulty absorption of fatty acid, absorption of bad fatty acid, and it can lead to the worsening of fatty liver. So we have to treat the both angles. For fatty liver, what we have already discussed, and for digestive issue, maybe you need to get checkup for more, like what is causing the digestive issue.
Thank you for answering that question for us, Dr. Singh. Moving on to the next question, which is fatty liver related to diabetic disorders? I mean, I think
100%.
it is fatty liver related to diabetes.
Yeah, 100%. So suppose if I see 100 patient who have diabetes, around 70 to 80% will have fatty liver. If I see 100 patient of fatty liver, 30% would have diabetes. So there is a direct correlation between the diabetes and fatty liver, because it are the basic pathophysiology is same for both the disease.
Thank you for answering that for us, sir. Now moving on to the next question by Ms. Navita Kumari. Ms. Kumari says, last year I was diagnosed with grade 1 fatty liver. Recently, I have been facing issues like acidity and digestion issues. Sometimes whatever I eat, I end up vomiting. And after that, uh, it feels like bile, pitta, vomiting, and I am also experiencing frequent burping. What should I do in your opinion?
So this is again two different disease. So first thing you have to know that fatty liver is just a diagnosis based on ultrasonography and blood report. It doesn't cause symptom of the digestive issues. Your digestive issues can worsen the fatty liver, but fatty liver won't cause all this recurrent vomiting, burping. That is more of associated with the esophagus and stomach. More production of the acids, inflammation of the gastric mucosa, that caused the burping and all that symptom you have mentioned. So to answer, fatty liver do not cause these symptoms, but these symptoms can worsen the fatty liver. So yeah, you may need to get evaluated for the GERD or gastroesophageal reflux disease. That what I feel is your problem is.
Thank you for answering that question, Dr. Singh. Moving on to the next question. Can you please elaborate on the gallbladder stone?
Okay. Good question actually. So if we see the why the gallbladder stones are formed, so these stones in the gallbladder are 90% cholesterol. They are hardened cholesterols. From where cholesterol is coming? It is coming from the liver that is not able to metabolize this. So if you see the people who gets stones are usually obese, they are fat, they have generally have diabetic, the person who remains prolonged fasting phase, or who takes excess oil. These are the people who are more prone to develop gallstones. So fatty liver do not cause directly gallstones, but yes, it is one of the reasons that can cause the worsening of GB stone or GB calculi.
Thank you once again, Dr. Singh, for answering that question for us. Moving on to the next question. Can you help us understand about dullness in the body, stomach iron? I'm not sure what stomach iron means. Uh, so, doctor,
I
that's the
think
question.
we should let's focus on the fatty liver and all this. So yeah.
Yeah, absolutely. Because dullness in the body could be due to various, 100 reasons which we even can't pinpoint, right? So, unless we understand what the issues are. So,
Yeah.
yeah, I mean, Dr. Singh, I think we have those questions only. We don't have any further questions, unless you want to add something to,
So what my
this discussion that
just
we had today.
final message to the audience will be that this fatty liver is something it gets picked up 90% incidentally, but like on ultrasonography or LFT Schrenger mobility. So first thing, we should not get panicked from it because it is something that can be cured. But again, it is something that we should not search for any magic medication. In the market now, there is lots of medicine for anti-obesity medication, Mounjaro, tirzepatide, semaglutide, that help in reduction of weight. But again, we are not targeting the root cause. What is the root cause? Root cause is the what we are eating, how much exercise we are doing, how much effort we are putting in maintaining our lifestyle being healthy. Because we can write 100 medication, you can take 100 medication until unless you go outside, do some exercise, give some time to your body, eat healthy, this disease will come back. Again, fatty liver stage 1 is not that we should be scared of, but something that we should know it is there and we should work on that. We should definitely get vigilant if it's go to the stage 3 or 2, because then it's go try to damage the liver from the inside, in which you should consult your hepatologist or gastroenterologist near you, and they will guide you better how to tailor the therapy, because it is not a just one prescription that fits to all. It is obviously a tailor made therapy. Different people require different treatment based on the comorbidities they have and based on what they are dealing with. I think, yeah,
Thank
that is
you. Thank
from
you
my
so
side.
much, sir, for taking this session for us and enlightening us with, the details that you have shared, thank you for answering all our questions. So audience, if we don't have any questions, Shahid, I am passing the stage to you. I think we can close the session if we don't see any further questions.
Yeah. So thank you so much, Dr. Ashish, for sharing such a wonderful and very useful insights regarding the fatty liver. And thank you so much, Mansi, for arranging this and reading out the question for Dr. Ashish. Obviously, it's very useful for us as well as for our audience as well. We will surely come up with more interesting topic like this. And once again, sir, thank you so much for joining and have a wonderful day. Thank you, team. Thank you, everyone, for joining.
Thank you.